Let's talk about goal setting for a second. So what you may be thinking is, my goal is to get out of pain, or my goal is just to be able to use my limb again. And that's really non-specific, well-intentioned, but non-specific. What we want to do is break down this goal setting concept into sort of a couple ideas. The first one are short-term well-body goals. And we do this for a couple reasons. When I say a well-body goal, I mean, hey, I'm going to have to protect the surgical site for an explicit amount of time while my tissues go through their healing phases. So, for example, with a knee replacement, it might take upwards of 12 weeks for that knee replacement to actually become bonded and for it to be less of a likelihood of it becoming sort of displaced. So which means that, okay, I'm gonna have to modify some of my work and make sure that I'm protecting this during this time while the tissues grow in. The same thing is kind of true about an ACL, a reconstruction. There's just a certain sort of healing phase where, hey, even though it may only take 4 to 6 weeks to manage an ankle sprain, it turns out that tendons and ligaments and some of these bony things take a little bit longer to knit up. So in that short time, what we can do is set up well-body goals, which means that say I had a lower extremity injury, I might set a well-body goal saying, hey, I want to be able to do 20 strict pull-ups or 50 strict push-ups, or I want to be able to seated press my body weight or bench press 10 times my body weight 10 times, something like that. And we do this for a couple reasons. One is it keeps us focused on what we can do and actually organizes our training towards some end instead of just sort of being caught in some kind of rehab loop and I'm just exercising without purpose. It allows me to chase down a kind of crazy goal, which is really important. It allows me also enlist other people into my goal, so I kind of have a training cadre around trying to solve something or come up with a solution to this kind of maniacal goal. One of the other reasons is that it keeps us plugged into our training communities. One of the things that happens with surgery is we tend to think, hey, I'm gonna be off on myself, I'm gonna rehab. This is a terrible idea. One of the big problems we have with surgery is that it tends to pull people out of their psycho-emotional groups. It pulls us out of our tribe, pulls us out of our communities, which is really a stress on the animal, stress on the human. So if we can keep you in your classes, in your gym environment, chasing your own goals, working alongside the class, working alongside your training partners towards these goals, what we have is a much healthier, happier human. So well-bodied goals are important. So I want you to try to write down right now, hey, I'm gonna do a couple things. There's an old statement by a coach I really liked who said, you know, when you become dealt the hand of the specialist, become a specialist. So this is a chance for you not to have to train your lower body for a minute. Maybe you get to work on your pistol on your other leg and you get to kind of chase down some of these crazy goals for your upper body. Fantastic. Hey, I'm gonna do an arm-only 20-minute assault bike race. It doesn't matter what it is, as long as it's outrageous and it gives you a way to focus. The second thing is that what does my return to life look like? So what I want you to keep in mind is that it's useful to have some kind of training goals here in the language of strength and conditioning. For example, at 16 weeks, I wanted to get close back to my 1 rep max deadlift. I wanted to deadlift 500 pounds at 16 weeks. So 12 weeks was that time where I could start to load again. I could start to expose myself to higher forces. And at 16 weeks, I thought it was appropriate for me to go ahead and take this thing for a run and see if I could get back. And so this deadlifting goal of deadlifting 500 pounds in 16 weeks was really great because it focused my training on making sure I had some early exposure and stepwise exposure to this stimulus so that I wasn't like, okay, a whole bunch of time has passed and now I'm gonna try to do my thing. It really allowed me to start to say, hey, look, if I wanna be on my bike at 12 weeks or I wanna start doing these things, I need to make sure that I'm starting to expose myself so it's not gonna be an all or nothing sort of piece. But more importantly, what we really wanna think of is what does that deadlift get me? That deadlift got me exposure to being able to ski, exposure to being able to ride my bike, exposure to being able to play, exposure to being able to hike my kayak into things. And so it's important that we're setting some training goals for the involved limb, but it's more important that we're thinking about how we're gonna use that and writing that down so that we actually feel like we're able to finish the healing process. One of the reasons we wanna have goals and the return to sort of life goals that are high and hard to get is that it ends this sort of formal process around the surgery. Otherwise, what we think is, oh, I had this surgery and I'm just kind of ghosted by it, versus, hey, I worked towards this sort of summation, which is, hey, there were a lot of training in sort of variables in there, but ultimately it's about the expression of those training variables so that I can kind of encapsulate that, wrap it up, and then move into my post life. Now, you may never ever get out of thinking about your knee or your elbow or your shoulder. There'll be times where you have to put a little input in, because as we say, that tissues that have been injured or tissues that have been surgically repaired can never be normal again, but they can be normalized. And they can be normalized at such an incredible function that you may never think about it, except once in a while when you've overdone it, or it gets a little bit stiff, or a weather system comes in and your big toe starts to ache, whatever it is. But understand that this well-body short-term goal setting is really important in the interim, wrapped up with some explicit training kind of goals, things that are measurable to the kilo or to the time, and then what that looks like, so that we can keep you plugged into your training communities and that we can sort of formally end this rehab process. So hopefully that gives you a way of we're thinking about goal setting. And one of the things that is useful is to sit down with a loved one or a training partner and use this as an exercise. Hey, what should I work on? What should I do? And then, of course, enlist that person into your evil schemes.